real-world study as complementary studies. They are really necessary because, patients from the trial, they are selected. They are not common patients because we avoid patients suffering from stroke, for infarct and so on. So the patients we have in real life, they are patients we see in our clinical practice. So real-life studies are really necessary. And the other reason is that you have a huge number of patients. So you can have conclusion from huge number, which is better. And so the main results of this study is that you can confirm or not the results you observed in clinical trial. The rationale is to have many patients to be followed for a long time, because they will be followed for many years. And so we can phenotype very well the patient with the past history, the blood pressure, the fact that the diabetes is balanced or not, and so on. And we can follow them for long, and knowing first of all how many injections do they need, and then whether you have the same efficacy as in the clinical trial, and some safety issues. Well, this study is currently ongoing. It's not finished. We have some only intermediate results, and we can characterize fairly well the patients at baseline. And for instance, it is very interesting to know that in most cases DME is bilateral, and we were able also to have the number of injections which is was the same as in clinical trial if you use a PRN regimen. The main limitation is that you have to inject the patient quite often. But this is true mainly for the first and second year probably. That's why you need to convince your patient to come a lot at the beginning, because they will need to be injected a lot. But then probably you can decrease the pressure because you can decrease the number of injections. And from previous trials we know that after 4-5 years, almost 50% of the patients were no more injected. So what you have to negotiate with your patient is that you need to come at a monthly regimen to be injected very often during the first and second year, perhaps the third one. But then you can be almost sure that you can decrease the number of injections. So the SOE is in Nice for 2019, so we are very happy to welcome you in Nice.